Governor Kasich, I want to start with you as a lifelong principled conservative, a guy who ran a state, who understands the impact of a lot of the stuff, a lot of the cuts that are being talked about in this package, particularly to Medicare and to Medicaid and what that might do to rural hospitals. When you look at a bill this big with this much in it, how do you feel as a guy who served on the Hill, but also as a guy who ran a state?
Well, first of all, I was chairman of the Budget Committee when we balanced the budget in the the last time it happened since man walked on the moon. So, look, I knew this was going to pass. I knew they were going to cobble stuff together. But the problem we have here long term is that we are racing towards the edge of a cliff when it comes to this national debt, which continues to go up. So I have great concerns that, first of all, when you take a look at Medicaid, Medicare, the health care programs, they need to be done together. There needs to be a complete reform of the health care system in the United States. And you do that by locking the doctors, the hospitals, the insurance companies, the pharma companies in a room and say, let's begin to treat people to keep them healthy rather than treating them when they're sick. A fundamental reform of health care. Secondly, frankly, we do need a balanced budget amendment so that Congress operates like the states. With this national debt growing so high, Willie, I have to tell you, at some point, people around the world will stop buying our debt. And when that happens, we run a printing press. And we run a printing press, it causes inflation. Every family will be hurt and some will be devastated. So, look, this is where we are now. There's no appetite for being able to fundamentally reform the federal government. One other thing, I think the Republicans have failed to be able to define the why of this bill. If you're going to do something that's significant, you have to tell people why you're going to do it. And then once they understand why you're going to do it, or at least they get a sense of why you're going to do it, then I think you have more support for getting done what you want to get done. But this bill is going to pass. But it's another effort to kick the can down the road when it comes to the tremendous fiscal problems that we're facing in this country.
So, Governor, putting on your governor's hat for just a minute, can you talk about some of the concerns expressed, particularly by Senator Susan Collins in Maine, about what almost $1 trillion in cuts to Medicaid means to rural hospitals, what it would mean in a state of Ohio? Just on the ground, practically, what do these cuts mean to a state like yours?
Well, Willie, it's not an easy question to answer because it's complicated. In a nutshell, when I became governor, we grew the Medicaid program by 4.5%, while I expanded Medicaid and added 600,000 people. Before I was governor, it grew at 10%, and now it's growing more than 10%. And that's because we managed the program in such a way that we made fair payments to people who were providing Medicaid. In other words, fundamental reform of how Medicaid worked in Ohio worked for us. If all you're going to do is go and slash without being able to engineer the proper way to make sure that you can reduce some spending while at the same time saving those people who are the most vulnerable, that's a mistake. So as the governor, by reducing the growth of Medicaid, I was able to expand it and at the same time have it grow at a lower rate. I mean, more than half the rate that it's been growing before I was governor and after. So the reason it's a complicated answer to your question is there are ways to reform this system where you can significantly change it and reshape it without having to hurt vulnerable people. I don't know what the level of this is going to be or how they're going to deal with it. If you're going to phase in this provider tax in such a way, you need to do it over time because you don't want to hurt people and you don't have to balance the budget tomorrow. You have to get on a path to get it done, which is exactly what we did under Bill Clinton when Republicans and Democrats came together. We actually balanced the federal budget, paid down debt, and had our economy roaring. That's the approach that needs to be taken today.
So, Ali, as we look at these pictures from the Senate, we're entering now hour 23, I believe, of the so-called vote-a-rama. As Governor Kasich says, you'd make a lot of money if you bet on Republicans going along with Donald Trump in the end, no matter how long this fight goes on. So what is your sense of the whip count as you talk to your sources this morning?
Well, we heard the Senate Majority Leader John Thune say at around 4 o'clock this morning that he wasn't ready to pull the bill yet. We've seen senators filing in and out of his office. I just checked in with another Republican leadership source asking if that was still the posture, that they were still going to try to use the pressure, this ongoing vote-a-rama, to get Republicans to yes. And it seems like that is still the posture. They are on track to keep running out the clock on the Senate floor while also having those behind-the-scenes negotiations with key senators. I think what's interesting, and we've talked about this, is who those senators are. We know that Senators Susan Collins and Lisa Murkowski have voiced that they have concerns about the way that this bill is written. And I think Sam Stein made a great point in the last hour about how for Murkowski, it always comes down to Alaska. But for the lower 48 states, is it worth what Murkowski can get for her constituents to then kick off these tens of thousands of other Americans from their health care programs? And I think what's so fascinating here, and maybe Governor Kasich, you've been in these kinds of positions before and you can speak to the lawmaker mindset here, but it does feel like privately a lot of these Republicans have concerns about the kind of policy that they are putting into practice in this bill, and yet the politics of the moment is overtaking it, even as they are making these cuts to health care programs, kicking people off of their health care, and also not even being able to accomplish the central goal of it, which is to rein in spending. So is it even really a win here for Republicans who in some cases don't like this bill but are still going to have to vote for it anyway?
Well, my sense on that is that they're all lining up to do this. Look, if they don't pass this bill, it derails the Trump agenda and to some degree the Trump presidency. That's why it's going to pass. Yeah. And I know what it's like in those tense moments when you're trying to get something passed that makes a lot of sense. I mean, when back in the days when we were trying to do some significant things, I mean, there were Republicans that sat in the back and tried to avoid voting. And, you know, we'd get on them and talk to them about why it made a lot of sense and ultimately would win. But I got to tell you, as that clock is ticking down and you're running out of time, think about an NBA game where, you know, you're down by 1 and you got the ball and there's only 10 seconds to go. You got to get it through the hoop. Now, look, I just think the whole thing was put together in a very odd way. I have to tell you folks, and I know this is not something that you hear a lot or maybe makes a lot of sense to you, but if we keep going forward and spending the kind of money that we have and ringing up this debt, we are going to pay a high price. Exactly when that will happen, I can't tell you. None of the experts can tell you. But at some point, people are not going to want to buy more of the United States debt that we continue to ring up. We need a fundamental restructuring of the entire government. And I think Musk was trying to do that. The problem was he looked at anybody working in the government as an enemy. What we tried to do was to understand every function of the federal government. We could privatize, we could eliminate some, we would create priorities. It's the same thing I did as the governor of Ohio. And let me tell you, at the end of the day, we were up 500,000 jobs in Ohio. You can do these things. You re-engineer the government and you pay no attention to the special interest groups who get fed at the trough of government spending. In other words, sometimes you got to tell them, we're not doing it this way anymore. And if you get hurt politically, I told you to tell them, that's tough. I'll take the heat. It doesn't matter. But that is not happening in this bill. This is just kicking the can down the road. In terms of tax cuts, part of the way in which you control the spending, part of the way in which you help our economy is you have to have tax cuts. Some of the tax cuts in this bill, I think, are ridiculous and should be taken out. But the pro-growth tax cuts are critical. If you don't grow the economy, you can't get yourself in a position where it all begins to balance out. You reduce spending, you grow the economy, you begin to provide confidence in the markets for every American in this country.
Well, Governor, your point about the debt makes actually a ton of sense. For some reason, it's always been an abstract point that people don't feel like hits them today, but it is coming, as many, many people like yourself have warned us, and it won't be pretty when it does. So, Mike Barnicle, there is the question of conservative principles like the ones Governor Kasich has, which is small government, not adding to the debt and the deficit. The CBO says this would add $3.3 trillion to the debt over 10 years. Versus the pressure they feel from the Oval Office, from the man to whom they've pledged loyalty in many cases. And in the end, over the last decade or so, they've always gone the way of Donald Trump.
Well, Willie, you just used the word pressure from the White House. I'd substitute the word pressure for fear of the White House.
Yeah.
And Governor Kasich, in talking about what happened in the early 1990s when he and Bill Clinton worked so well together, and we did indeed have a balanced budget thanks to people like Governor Kasich, I would submit that was a different country politically. It was literally another century when all of that happened. And yet today, what we're seeing, very few things happen in Washington that people should sit up and take notice and pay attention to. This is one of those moments because a Republican Party, led by Donald Trump, is on the verge of inflicting a tsunami of personal grief on millions of Americans. 1 in 5 Americans are on Medicare. And 1 in 5 Americans who are on Medicare, they're not wealthy. They're not going to the Bezos wedding. They weren't even invited. They weren't even thought of. They're poor. They're on the edge every single day with their children and their families. And to take health care away from them, my question would be not only to Governor Kasich, but all the other Republicans. How is it? How do you go to work every day in the United States Senate now, this morning, with the idea that we're going to inflict more pain on people who live with pain each and every day? And Governor Kasich, I want to know what you think of the differences in the Republican Party and this Republican White House from the days when you were in the House. You're a Republican, a staunch Republican, but the difference in politics today as compared to then in terms of getting things done for people.
Mike, it's terrible. And look, when it comes to the whole issue of health care, remember what I just said. I was the first Republican governor to expand Medicaid. I covered 600,000 people who had not have health insurance because I didn't want them living in prison or living under a bridge. And I think it is absolutely a moral principle to make sure that people are able to get health care and that we can't just willy-nilly dump people from the rolls. And I can't tell you exactly how this bill is going to be impacted throughout the states and what they're going to do. But what I can tell you, Mike, is those people who provide services, a number of them, the nursing home industry, for example, they're going to have to get a reality check. You can't keep getting more and more money every year to provide the same service, but we need a fundamental reform in healthcare. In addition to that, Mike, look, this is a different time. I'm not living in yesterday. I know what the reality is today, and it's just unbelievably terrible. I talked to members today who are just not happy with being there. What I've always expected or wondered about is why aren't we having Republicans link up with Democrats who are moderate as well and start to create a new coalition from which we can govern? That's what I had been calling for when we had the fight over the speaker's job with McCarthy. Why can't Republicans and Democrats come together? Because I'm a Republican, but the Republican Party was my vehicle. Mike, it was never my master. So my job was to serve the public, not to serve a political party. And too much of that now is self-interest on both sides of the aisle. And that's why we are not solving America's problems today. Without both sides getting along and respecting one another while they disagree, we're not going to solve these problems. And they are critical for our country's future and our children.
Amen to that. Former Republican governor of Ohio, MSNBC political analyst John Kasich. Governor, thanks as always for your time.